Great. We are recording. Okay. So let me start with Brandy. Brandy's got to step off at 2. Do you have any quick announcements for our faculty, updates on anything?
Yep, just really quick things. Most of these are reminders. I don't have a ton of new information since last Friday. So Jennifer asked about reminders about the pink slips. If you have had students who've never stepped foot in your classroom and are asking that that be an online class, then that pink slip process does need to happen to create that special section for regulation purposes and reporting purposes. Those pink slips are processed in your units, but either Jennifer or I or both should be copied on those just so that we have an idea of the big picture of what's happening within the college and so that we know what sections are available in the advising office. My second reminder is the academic alert system issue. They're transitioning to a new system. In the meantime, there is no system. So the idea is that they want instructors to reach out to students directly. If you have trouble getting students to be responsive to you for attendance issues, assignment submission issues, please reach out to the advisor. We want to have that safety net in place, even though we don't have a formal academic alert system right now. My next reminder is the Title IV monitoring. So that's monitoring period should all be happening this week, and the reporting period opens next week. And there's directions that came from Kim Taylor's office about how to report that. That's just making sure that students are actually engaging in the classes. If you need help with that, please let me know. And then the last thing I wanted to say was just a kudos on getting through the first 2 weeks. I'm hearing from a lot of our CI students about what a great job our college is doing at being a point of contact for them and helping them and assisting them and just being understanding and accommodating and compassionate human beings. So kudos to our college on doing a great job with connecting to our students.
Thanks, Brandy. I'm going to read, we got a notice from Larry Holloway, Vice Provost, to the deans this morning, and I'm just going to read parts of that for you guys, and it's about absences and accommodating the absence. So let me pull that part up for you all. I can get it. Okay. It is, sorry. So he's just said, basically, deans, please encourage your faculty to excuse absences of students who miss class for COVID-19 testing. And so basically that when they have to go get their test done, like a retest or whatever, during the pandemic time, testing is important to identify positive cases to reduce the spread of the virus. Since UK is using a third-party partner, Wild Health, to conduct COVID-19 tests, Health Corps will not have immediate access to information that would allow them to certify that its student received a test. There are cases where the student may lack evidence of the test other than result notifications that would come days later and that would disclose the diagnostics. Faculty members should not compel a student to disclose their diagnosis. So basically you can't say, did you get tested? Show me, you know, where it says you're positive or negative, because that's personal health data. We can't ask them for that information. Let's see, as in the past, pre-COVID-19, students may provide to instructors their own explanatory statement for absence from class form available. And then there's a UK healthcare link that I'll drop in the chat in just a minute for absences. However, there may need to be a level of trust by the faculty that student is reporting truthfully that he or she had a test, and testing is important. So basically he's just trying to encourage everybody to give some leeway when they say they're going to test. If they've been exposed and they've been asked to retest, there's really not a way for us to show that. And so I'll put the link to the form in the chat here in just a minute so that you guys can have that. And so with that, we did not have our academic leadership team that we normally been having at noon today, and I thought that Lance and James and Brian just, you know, needed to make up that hour of meeting some other way. So I invited them. They've been
Please take the parking ticket.
Whoop.
Please enter following
Someone else
guide.
is driving. That happened to me earlier. we decided we would have them come in because they've been great in answering questions on the chat that have come up in the leadership team meeting. So I thought it would be great for them to present directly. And I think, Lance, you do have a presentation, and if you guys will introduce yourselves, and I'll just give you the floor at this point. And do you want me to make you a host so you can share screen?
Actually, it's going to all come from my mouth. No screen. So
okay.
Yeah, and we can go in any direction once we sort of lay out some basics that we think you all might be interested in. We did something like this earlier this week for a large group of faculty in arts and sciences. And following a similar pattern, we gave an overview of what you might expect and how you might engage with from testing and health core support through your roles as folks who are on campus as faculty and staff members, and what you might expect in terms of working with your students. We found any number of, a wide range of questions, those that we couldn't necessarily have anticipated, that came from faculty in A&S, and that was a good experience. So I would say, I think they found that helpful, and I'd say, to sticking to that sort of the essence of what they wanted to accomplish and what I think we can do here today. Yeah, whatever that question is, we'll either be able to answer it or send you in the direction of someone who can. So I'm Lance Poston. I'm one of the project leads for UK Health Core. And for those of you who've worked with me before out of communications, you may also know me out of institutional diversity, but I'm wearing a health core hat, not an institutional diversity hat here. And I've got several colleagues here from the Emergency Operations Center, which is a key partner organization that is scaffolding and managing campus-wide restart efforts. And let's see, who are those folks here? I see Sarah Geegan, who's here from also a PhD student in your department, and one of the best communicators that I know. So Dean Breer, Sarah should get an A+ already if that wasn't on your radar. I'm sure it was. I see Nate Brown and James Frazier from the EOC, and Brian Nichols from the EOC, key partners in making all of this work. Did I miss anybody? And Sarah, James, Nathan, or Brian, do you all want to say anything beyond that in the intro? Okay, I'm not hearing anything, so we'll move forward. So if you think about three key parts of the university that are making restart possible, and doing that with respect for one another, as we wade into this, this new era and this fall unlike any other, and thinking about doing that in the way that reduces risk as much as we can and works to keep our campus safe. Those three major pieces that are at play are the START team, right? The Dean DePaula, the College of Medicine, leading that group of healthcare experts who are providing recommendations to senior university leadership. Those recommendations are what transitioned into a lot of what we've been executing out of Health Core. So Health Core, the second of those three, is the organization that is providing testing notification, contact tracing, and follow-up support for students, faculty, and staff on campus. And the third organization at play here is the Emergency Operations Center, a long-standing structure at UK that deals with large-scale problems. And the one that they've been stood up and expanded right now, again, working in partnership with the START team and Health Core to tackle is, right, what coronavirus looks like on our campus. And so if you think, again, about the sort of hub of what Health Core is doing, so many of the peripheral parts of that are managed and informed and guided by the Emergency Operations Center. So especially when we get to the Q&A portion today, if there's something I don't know the answer to, I'll pivot to one of my partners here from the EOC. So maybe we start with an overview of what our process looks like and what you can expect in terms of engagement with Health Core, what services we're providing to the campus. So we're headquartered out of two physical locations at UK. One, I'm in the Boone Center right now, the old faculty club. Sadly, the chicken salad has run dry, and there's no lunch to be had here, meeting with your colleagues, but we have turned this space into a call center where several types of staff members who make Health Corps' daily work happen are based here. Also out of King Library, we've got a second location there on the main floor. And I'll talk about the kinds of staff we have working here in a few moments. So at this point, if you're testing on campus and you're testing either through Wild Health, our third-party partner who began in phase 1 testing with testing anyone who's going to, any student who's going to set foot on our campus in any way this fall, and transitioning into phase 2 testing, which has been focused on members of our fraternity and sorority life community most recently. Wild Health, is the testing operation through which those individuals are coming. The test results from Wild Health are making it to Health Corps, and we're picking up the ball from there. A second place where test results are coming into us from is University Health Service. So student and employee health, if an individual is tested there for the last week and a half or so, they're a second stream of test results coming to us. When we get those in Health Corps, we pick up the ball there. Thirdly, in the broader UK healthcare environment, the emergency department and the Turfland drive-through, we're bringing those on as additional spaces through which student test results specifically will make it to us here. So when we get test results from any of those locations, if it is a negative test result, we make an automated notification through secure email. If it's a positive test result, one of our contact tracers and case managers makes a call to that individual. It's never an automated process. And we begin what is usually a 45-minute to an hour-long conversation. And that starts with letting you know that you've tested positive for COVID-19. We talk through some key facts you should know about a COVID-19 diagnosis and some myths that you should also be aware of about COVID-19. We build a plan for that individual for what isolation looks like, right? And thinking about how you're going to spend time away from others while you get well and make sure that you're not passing that virus on. And then that conversation ends with what's the lengthiest portion of that initial call, which is the contact tracing process. So we go back in time, depending on symptomology, from the date that individual was tested and came back positive, to look at likely contacts who are high exposures. And what that looks like for us is getting a narrative and a list of individuals that known positive has been in touch with, who have been within 6 feet for 15 minutes or longer with that person. So from that conversation, the contact tracing conversation, we then create a second list of individuals who are high exposure contacts. And there'll be subsequent conversations with folks who are high exposure contacts, letting them know that, right, while you haven't tested positive, you've been in a situation, again, within 6 feet for 15 minutes or longer where it is, there's a higher likelihood that you could have gotten COVID-19. And as a result of that conversation, we ask that those individuals quarantine. And I'll pause quickly to give two key definitions of words that I still catch myself using inversely at times, but that are really important and mean different things. So if you're a COVID positive individual and Health Corps contacts you, what we issue is an isolation order. And that's in partnership with the Fayette County Health Department, isolation being the key word there. If you're COVID positive, we're issuing an isolation order. If you're a high exposure contact, right, you haven't tested positive, but you've been within 6 feet for 15 minutes or longer of an individual who's tested COVID positive, we issue a quarantine order. Right, so in effect, we're asking you to do the same thing, right? For a standard period of time, you should disconnect and be physically distanced from others, but isolation specific to COVID positive, quarantine specific to high exposure contacts. Okay, so someone makes it through that process with us for that initial conversation. That's not where the Health Corps facilitation and support ends. We have a second group of employees in Health Corps called Wellness Connectors. And they are specifically tasked with regularly following up with individuals who've tested COVID positive to make sure that really anything they need while in that quarantine or isolation, or folks who are quarantined within that quarantine period, that they have those components to stay well and get well, and right to live as full a life as they can while in quarantine or isolation. Those components could include a student having a prescription that's at the Kroger pharmacy and they can't physically get it because they're in quarantine. We've got a car that our wellness connectors have here behind the Boone Center, and they can physically go get that prescription and take it to them. It could be you're in a space off campus and you don't have great Wi-Fi. And as a result of that, we could deploy a Wi-Fi hotspot to you. It could be not providing a physical thing, but maybe you don't understand and have never had to go through the process of setting up a telehealth appointment through University Health Services. And the Wellness Connector can walk you through how to do that process and stay in quarantine or stay in isolation and be able to access those healthcare services. A final important member of the Health Corps staff that can come into play after that first call is our academic coordinator. Her name's Leah Vance, and she came to us from CELT, from Kathy Kern's office there. And Leah Vance is a key conduit for any student who's having academic issues related to a COVID-19 diagnosis and isolation or high exposure designation in quarantine. So those Leah services look like, making sure that a student understands that they have language that they can provide to their faculty member or their supervisor, that they're not going to be able to be in class. We keep that language very vague, essentially that they have restrictions on their movement placed by Health Corps that keep them from participating in person. Again, not disclosing healthcare information there. But Leah can provide that formatted letter to students there. If a student is having technology issues, again with course modalities, or doesn't understand how to use a particular feature of technology to access class, she can be a conduit to making sure they ultimately understand. If she can't answer that question, finding someone who can. And as students maybe have questions or miscommunication or points of conversation with faculty members in classes that they're enrolled in, Leah can make referrals to CELT, and their folks can then reach out and surround that faculty member and support as well. So we're trying through that process of Leah, our academic coordinator, and referrals to CELT for faculty support to make sure no one falls through the cracks there. As a student, if you are well enough to continue learning, we don't want a quarantine or an isolation order to prohibit you from doing that. So we've talked a little bit about the EOC, Health Corps, and the START team as three key parts of this narrative. We've talked about our process, where test results come from, and then what follow-up looks like from that. A final process point that could send one onto Health Corps' radar is answering a daily screener, answering that attestation in a certain way that would send up a red flag. So hopefully everyone on this call, if you're spending any time on campus at all, is getting that daily screener. An email version now, we're nearing the launch of an app version of that screener. And it's essentially asking you two basic questions. Do you feel ill, or are you taking care of someone who is ill? If you answer no, that's simple. If you answer yes, you'll see additional questions that provide options for you to be specific about the CDC, the word I'm looking for, symptoms that you're experiencing. So it gets more specific if you answer in a way that keeps raising red flags. The second of those questions is, have you been within 6 feet for 15 minutes or longer of someone who has tested positive for COVID-19? Again, if you answer no to that, as most of us probably do every day, the survey's over, if you answer yes to that, there'll be some additional questions, and you'll receive automated advice that can raise to the level of quarantine and seek medical advice. So the screener, again, is another way outside of a test result that you could make it onto the Health Corps' radar. We've talked a bit about types of staff, our caseworker, tracer roles, our wellness connector roles, and our academic coordinator roles. And I've mentioned the letter that is provided to all students who are told to quarantine or isolate, that they have then to be able to provide to their instructors or supervisors. And that letter, again, is provided as an option. We strongly suggest the student provide that for ease of transition, but we don't do that automatically, and we can't because of the private health information implications there. So I think I've been through my list of the overview, but I know there are many ways you might want to dig into different parts of that, or maybe some pieces I didn't talk about that you have questions on. So Dean Greer, if you're at a good point, we can stop and do questions.
Okay, I'll start with one because this was something that just didn't occur to me until maybe the first couple of days of classes when these issues started coming up, that is all when they're coming through the Health Corps screening process and testing process. And I know you get other tests from other places here in Lexington, but we do have students that did their tests out of state, or they may like go to the Walgreens to get a test when they know their friend has tested positive. How are we tracking those, and how do instructors, I think that was, it was just a missing part of my brain that, oh, not everybody's coming through this pathway. And there was some confusion from the faculty about, and also I think the Kernel article that came up about like where the contact tracers would start notifying people depending on where they tested positive and who was doing the tracing, if it was out of region.
Yeah, so a couple answers to that. We did provide students the opportunity to have a test outside of UK before they arrived on campus, as an alternative if the test met certain specifications, and they could upload those test results to their UHS, their University Health Student Health Portal, and those have subsequently transitioned to their files here in Health Corps. So we have that initial data. You're right too that individuals could test in any number of places that don't fit into our UK system. What we hope we're doing by making testing as widely available as possible and messaging, through many different venues at UK, is that we're making it very clear and very easy that as a student you can be tested here. We know in reality there's still going to be folks who are going to do it elsewhere. So here's what we'd love your help in doing. Anytime you hear from a student who's tested elsewhere, encourage them to self-report to 218-SAFE. There are no additional, there's no punitive component to that, of course. What testing or self-reporting to 218-SAFE will allow you to do, and that number is our hub number for Health Corps. It'll allow us to then reach out, check in with the student, and make sure that we can provide those additional wraparound services beyond contact tracing that you're not going to get from the health department, or whether it's Fayette County or in another jurisdiction. So certainly you all encouraging students to self-report if you know they have a test from elsewhere. And you can also send us a note. We won't be able to follow up and confirm with you, right, that a particular student, we've got their record or not. But if you have a student, say, I tested at Central Baptist or Urgent Care and it was positive, you can always send us that information too, and we can make that note in their case file.
Is there an email to forward things to? Because this is the first time I've heard the 218-SAFE, and I don't mean to be, maybe I just didn't realize that was a number for students to call, but is there an email that we can send things to?
There is, and I think I'm at the point now where I go to sleep at night and 218-SAFE is just on repeat in my mind. So I'm taking it for granted that others are there too. But so thank you for pointing that out. Two really important ways to communicate with us. 218-SAFE goes to our operator, one of our communications folks here in Health Corps, who are also both wonderful graduates of your college, or healthcore@uky.edu. And that email account is our central email account that those same individuals help sort through.
Okay, I'll ask one more question, then we've got a whole bunch of journalists on here, so they probably have lots of questions. What is your cooperation with the Fayette County Health Department? So if you have a college-age student in Fayette County who tests positive, but they haven't really asked whether they're a UK student or not, do you have that kind of cooperation?
Sure. So yes, we do. We have a rich and long-standing relationship since Health Corps existed. We've had this relationship with Fayette County Health Department, and it looks like an everyday meeting. So we spend anywhere between an hour and a half and 2.5 hours a day with the Fayette County Health Department and officials from the Health Cabinet in Frankfurt, going through each of our cases to make sure that we're all on the same page in terms of who's following up with whom, and that no one is falling through the cracks there. So that's a continual relationship that takes place on a daily basis through reconciling and 7 days a week.
Okay, great. I'm going to read a question in chat, and you guys can unmute yourself or put it in chat, whatever's easiest for you. But this was a question. Now that phase 1 is done, is there a planned follow-up for any students who do not have a test result on file? And once phase 2 is complete, are there discussions about continuing testing for the general student population?
Sure. So phase 1 did end about a week ago, and we transitioned to phase 2. We're in the process of continuing to remind individuals, and actually Sarah and I had conversations about this morning, finding new ways to reach out to the small group of individuals who haven't tested yet. So that's ongoing. We'll keep communicating and escalate that communication until we're sure that we've got everyone who should have tested, who is coming to campus, tested. Phase 2 initially was, as the President Capilouto announced, focused on specific testing in our fraternity and sorority life populations. And that was a data-driven decision, understanding that at the end of our decision point period, our overall student body positivity rate was just over 1%. But we saw higher rates in the FSL population. And so that was one opportunity, one way that we used the data to say, okay, part of phase 2 is going to be focused on that subpopulation we see having a higher positivity rate. And we'll continue to use that same pattern to identify groups of folks who need additional testing based on where the data is going. I don't know if James or Brian, do you all have anything to add from an EOC perspective there?
We do not. That's accurate.
Question to follow up on that is, are the phase 2 results included in your daily testing results that you're reporting out? Are they being released publicly?
So phase 2 has not been released in the same way that phase 1 has been yet, but that's not to say that certainly that we're not going to. That data is forthcoming, and actually part of the process between phase 1 reporting and phase 2 is we've paused to look at what additional factors and data points that we could put out there that can be helpful in telling our full story might be. So as we shift into phase 2 reporting, I think you'll see other opportunities to engage in data beyond the couple points that were provided in phase 1.
And we are planning on communicating sort of our plans for reporting sort of holistically what happened in phase 1, and then how we're going to roll out phase 2. So phase 2, as Lance said, we're going to include additional data points and sort of have a more sophisticated dashboard available. So we're working on that now, and we plan to communicate soon what all is going to be included in that.
Another question in chat. I'm getting many emails from students asking, should I not come to my class today because ... Should I refer to them to daily screening and let that system answer the question for them? So I guess it's, if their sinuses are stuffy, they don't know if they should come to class. What do faculty do in that situation?
Yeah, so it's a new world, right? And we're trying, yesterday's answers don't necessarily always work here, but we are relying on folks' sort of awareness of themselves and the ability to, on some level, hopefully tell the difference between just allergies and COVID-19 symptoms. But right, for some folks, that's a really fine line. And we would rather folks be overly cautious, right, than not. So what we would say is, if you are answering your screener and the screener tells you to quarantine and or seek medical advice, then that's what we would want you to do, right? If you're getting that direction from the screener and you're answering as truthfully as you can, follow that advice. If that's a student and they're reaching out to you and saying, I have symptoms, you can reiterate to them not only to follow what the screener's telling you, but reach out to University Health Service and set up a telehealth appointment, and they can provide additional assessment there. So you won't actually have to come out of quarantine, but on your phone or your tablet, you can be seen by a physician who can give you additional advice there. But in each of those situations, yes, if the screener's telling you that you should stay in quarantine, or if you have symptoms that you feel like an employee that should be assessed by a healthcare provider, then do that and don't come to class.
Okay, I've got a couple of more questions coming in. I'm just reading them here. So are we at or near capacity of isolation in the residence halls for the on-campus isolation? I'm guessing the answer is no, but go ahead and if you have any data on that, that would be helpful.
Sure, we aren't publishing data at this point on our isolation facilities and usage of those. I can certainly say from a health corps position that I think we have a solid plan and plenty of opportunity as we need, if we need to expand those services and supports for students in isolation to do that. And we manage those isolation facilities in a close partnership with the EOC. So anything you'd add, maybe James? Oh, I think that was James saying it was perfect.
Yeah, that was right.
Okay.
We are not at capacity. And so currently we also have if we were to exceed the capacity on campus, we have arrangements with a hotel to be able to have a wing of that hotel with regards to expanded capacity if it's needed.
And that is one of the data points that you guys are watching when you're looking at multiple data points, correct? Of indicators of if we need to have a modality change. There's kind of a back and forth in the chat if you guys are following along about the communication with the governor's office. This has come up before on our Zoom forums in the college about what sort of cooperation do we have between the governor's office, and he did call out the university, was that yesterday or day before? Al, who's often at those press conferences, has put Jay Blanton's quote about working with the Department of Public Health and the governor's office to ensure safety. Sarah also spoke to that. Anything else you want to add, Sarah, on that point about the coordination with the governor's office? And
I mean, I would just echo what was in the chat. We're talking to them very regularly. We're talking through sort of data reporting protocols and what makes sense for both organizations moving forward in terms of having transparency and the most useful data available. So we continue to have open conversation with them.
okay, thank you. There was a question, I'm popping up back a little bit about somebody has heard from several students that there are entire fraternity and sorority houses that are under quarantine. Is there a point of communication for those kind of large scale quarantine or isolation situations?
So if an entire facility becomes a quarantine facility, we do have unique outreach and support for those folks. We have one of our contact tracers has a dedicated role reaching out to groups of fraternity and sorority life individuals, including those living in, say, a fraternity or sorority house, to make sure that they have unique supports, perhaps in a group environment for getting well, staying well, and staying academically engaged there. So those are situations that we continue to monitor, and because of the nature of the large size of some of those houses, we provide special wraparound services for.
Okay, I'm just going to add that my sister works at the University of Arizona, and they have testing that I thought was an indication through the wastewater. I don't know if you've seen that. It was like, for residence halls or fraternity or sorority houses or even office buildings on campus. Is that a technology that might be available to other campuses soon? Have you guys talked about that at all?
So that would be a conversation that would live in the START team, that has been a conversation that I know the START team has begun considering. But that would be a process that would move from the START team and ultimately a recommendation to administration. Yeah, and what a cool article. I mean, yeah, I'm a historian here, so not a scientist, but some of the technology to keep us safe is so cool.
And my sister's working from home, but she sent that to me, and I thought, oh, I mean, and basically you could get you can find 1 or 2 people who are positive out of 500 people who were in a residence hall, which was pretty amazing. And then they could do the tracing there. Couple of more questions in the chat. The ongoing testing for students, what does that look like? And you talked a little bit about the phase 2, but kind of rolling that out, and is that going to be just kind of constant while we're in the situation, I guess?
Yeah, so I think ongoing testing for students right now looks like 2 different things. Phase 2 testing on specific populations, again, right now that's been fraternity and sorority life, but we've looked at, and I think you will see very soon an expansion of what additional testing in those targeted ways looks like beyond fraternity and sorority life. So that's one way it takes shape. The other is for students who are symptomatic in any way. We've got University Health Service that has stood up the capacity to process several hundred tests a week. And that's out of our, the longstanding University Health Service building there on Limestone, right before you make it to Chandler Hospital. So for any student, whether they would fit into a phase 2 group or not, who's symptomatic, they can be tested there, and those results also come back through Health Corps.
Okay, I'm just pointing out in the chat that Nancy Harrington said James Keck in the College of Medicine got a CDC grant to study evidence of COVID-19 in wastewater, which is really cool that we're on the front line of that as well. Going back to a question that Kira asked about the app, and this, you spoke to it a little bit, Lance, about when you check no, you're not feeling well, or I'm sorry, yes, you are feeling ill, that it gives you some specifics to really try to clarify that point. And so she's just kind of talking about the app development. Kira, go ahead and jump in.
I'll clarify my question because I read it and I was like, oh, I want to edit that. My concern was, is there going to be a point where ill is defined in that initial question? One time I did choose yes, and I saw the list of things and I realized, oh, there were multiple days where I chose no because I didn't think it rose to ill, in which I did have these symptoms. So if you choose no, you never see the list.
Yeah. So as dangerous as it is for me to talk about science, it's also dangerous for me to talk about computer technology, but I'll try, and then maybe Brian fix something here if I say it incorrectly. So I think with the app, we are in this place where we're trying to balance simplicity so that people will actually do it, right? We want a high level of compliance, and so far with faculty, staff, and students, we have had a high level of compliance, which gives us a really important set of data for keeping our campus healthy. On the other hand, it's how do we dig in and further clarify without making it too cumbersome? And I can say that, not as the tech lead, but as someone involved in seeing that process unfold, we have made adjustments and continue to make adjustments as folks share back to us, this confused me, or this didn't work for my situation. And there have at least been 3 or 4 iterations of adjustment because of that. So Kira, I can promise to take that back to our tech team and raise it as a question. Brian?
I emailed it at one point, but I think I emailed it to the wrong place. So I really appreciate that. Thank you.
Of course.
Somewhere someone has an email that's like, why do I have this? Thank you.
Well, that's what, I mean, I had that situation where last night I was having trouble breathing because my sinuses were clogged up, and I took an allergy tab and I thought, do I answer that I'm ill, yes or no, this morning when I did my email? So I think that is a good point of what is it. And I'm sure if I'd said yes, it would have, gotten me to the point where it said it was fine to come to campus anyhow. But okay, a couple of more questions. This is one that's come up repeatedly in our college about, has there been any need to contact trace for specific classes? Are we just relying on the protocol of masking and 6 feet distance, to mitigate that? And so one of the things that I've tried to reiterate to our faculty when they get somebody that says, I am positive in my class, and they've reported that to the faculty member does not need to then go to the class and say one of your classmates is tested, because we would rely on our contact tracing process. And so if you want to speak to that.
Not only do they not need to, but they really shouldn't, right? Because you don't know what sort of situation you're going to ultimately disclose depending on, right, the size of the class or the way the class maneuvers with one another. So I'd say, yeah, you shouldn't be in a place where you do that. And so to answer the question, are we just relying on the room layout? No. In every individual case where we have a positive, we go through a full contact trace. And that includes talking about every class, because we understand that for the vast majority of our classrooms, with work that environmental health and safety, David Hibbard's office has done, and the work of Miri Vasevich's folks and our college facilities people, most of those places should be set up. The classroom should be set up in a way that you're going to be at least 6 feet apart if you're in that class, right? Most, we know not all, but most. But we still go through that process of each class you were in and how close you were to others, because we know people move furniture. We know that sometimes classrooms can become overcrowded. So we do ask that question in each situation when we're going through that timeline with a student. And the only way that you would be alerted from Health Corps as a faculty member teaching the class would be if you were deemed a high exposure contact. So, and in that situation, we wouldn't say, Lance Poston in your class tested positive in your high exposure contact. We would let you know that, you had a student in this class on this, or in a class on this day who tested positive, and through the contact tracing process, you were noted as a high exposure contact.
Okay, there are several questions in the chat about discrepancies of the reporting, and it's that, the Fayette County Health Department's going to say one thing and then the dashboard says another, and so people are kind of going back and forth in the chat about that discrepancy. And one thing that I wondered about, we had this issue in Tuscaloosa when it was actually for sexual assaults that presented at the hospital, is that they were defined as people in an age range, not necessarily if they were our students. My daughter got tested through, is it Blue Water is one of the testing sites here for her test in Alabama. She tested here and they asked her if she was a college student. She said yes, but they never asked her where she went to college. So she was not positive, but she might have been included in a UK number through that service because they identified her as a college student, but she was not going to UK. So just kind of the challenges that you have of why the numbers might look different in different places.
And that might be a question best suited for Sarah.
Sure. So I just dropped some of this in the chat, but I'm happy to kind of talk through it as well. So the dashboard numbers reflect testing results that we have gotten through our partner Wild Health through our phase 1 testing. So all students who come onto campus for any reason were required to get a test. But if students were coming from out of state or they wanted to get a test in their community, even if it was local, they could do that as long as they did so within sort of a 7-day window before they came to campus, and then they would upload those results to UHS. So that what's on the dashboard only includes the numbers that came from Wild Health. It does not yet include the numbers from UHS, and there were a number of reasons for that. Some students forgot to sign their consent form for UHS to be able to give that information to Health Corps. There were just a number of reasons why we didn't have those numbers initially, and we wanted to stay consistent. But when we put out our phase 1 report, we are going to include those numbers. So additionally, and I think Lance can speak to this a little bit more, there's some discrepancy in terms of what's getting reported to the health department. And Lance, maybe you can jump in and kind of explain why the health department numbers might include some things that wouldn't be in our dashboard.
Yeah, so the health department numbers, they don't have access, right, to Link Blues or student ID numbers. So, when they're designating someone as a student, I think, Dean Greer, much to what the example you gave with your daughter, we see that, and we can see that happening sometime, and we believe, right, that we're only seeing a small portion of when that happens. So I think that could be a mechanism for seeing a different number. The health department also is in Fayette County reporting numbers that are specific to folks who have isolation addresses in Fayette County. So if we have students who are isolating elsewhere, that can also skew the numbers in a different way of ours versus their numbers. Yeah, so it's not the same process, system, or definitions. And I thought of something earlier, actually, and this, so I hate to go back to the question before, but it's really helpful if you're in a space where furniture is movable in your classroom and you're thinking about the contact tracing process. If you're teaching in person and you have time to go in early before the class, right? If you've got a sense of how your furniture should be, double checking that it is actually that way. And especially during the contact tracing process, when we're talking to a student who's been in a classroom and a faculty member has said at the beginning of every class, as repetitive as it seems, recognize how far apart you are. Like, right, we've set these desks 6 feet or 8 feet apart and we need you to stay there. And reiterating the length between the desks or how far you are apart at workstations is something that will stick with students. So when our contact tracer says, were you closer than 6 feet for 15 minutes or longer, you saying that at the beginning of every class, notice how far apart you are, it is a key thing that lets them say, right, no, Professor Greer pointed out, each time I don't have to think about that class and who was within 6 feet of me.
Something else I want to point out about data reporting moving forward. So of course, these numbers, we started our testing on August 3rd. And again, students could upload test results, within that 7-day window. So if they arrived on campus on August 3rd, they could have gotten a test a week before that and upload those results as well. So this positivity rate is over a very long period of time. Moving forward, what we would like to do is be able to report numbers in terms of current cases. So some of those students have since recovered, they're back in the community. And so we think that it is sort of the best way to show the current campus impact is to provide numbers relative to what sort of the current situation is. And we're talking about including some additional data points, including number of students in quarantine, number of students in isolation, those kinds of things. So as I said, when we're talking about that more sophisticated dashboard, those are the kinds of things we're thinking through and kind of cleaning up and getting prepared to report.
So the question that has come up again, and it's in the chat, is there one number that would change our modality in terms of positive numbers of students?
When we have talked about sort of making a transition, like we did in the spring, back to fully online modality, there are a number of factors that we're considering, and I'd be happy to grab those and throw those in the chat. But positivity rates is certainly an important factor. There's no question about that. But we haven't designated a magic number, and there are a lot of other things that we're considering as well. So I'll go grab those and I'll throw those in the chat as well.
Okay, sounds good. Then back to kind of what you were talking about, Lance, with the contact and the 6 feet with the desks. A couple of questions from Kira, and then also one that came up from Nikki Lewis about, are we doing kind of tracking to see if, even if it's 6 feet apart, that we're seeing 7 or 8 students in this one class and everybody's reporting that they're 6 feet apart. So maybe the guidelines might have to be adjusted since we're trying to all figure out about transmission. Kira, did I ask that the right way? And then Nikki also talked about congregating, you know, that students are congregating. They may be 6 feet when they get inside, but they're waiting for the classes, and they're together 15 minutes before class, more than 16 or 6 feet apart, because they're waiting to get in or they're switching classes, and there is some extended time there.
Yeah, that was pretty close to what I was asking more specifically was, are we tracking clusters at all? Like are we checking to see if we're having clusters pop up related to classes or locations that aren't matching people's reporting of contacts?
So yes, looking at clusters and being able to find trends of student positivity is something that's been key and a key part of our evolving our practice from the beginning. And I don't want to sound like a broken record, but that noticing clusters in specific FSL organizations was how we shifted there. And there are other organizations we pay close attention to, right? Depending on, are you playing a particular sport? Are you engaged in a particular type of club that might be high engagement? And I certainly think if it reached a certain point, we would also be able to notice particular college or classroom building in the themes from contact tracing. Yes.
And then the congregating outside, because there's not really faculty or staff that are sitting outside with those students trying to, you know, in most of our classroom buildings, it's just the students are kind of on their own out there. What can we do to help in that area?
Yeah, so I think we've talked a lot about whether it's congregating together or noticing someone who isn't wearing a mask. We don't want to put people in a space where they don't feel comfortable engaging in a conversation. But we've got some really great materials on having difficult dialogues and de-escalating conflict in those moments. Where if you do feel, and that's coming out of our Office of Student Conduct, if you do feel confident and want to have those conversations, we certainly encourage you to in a straightforward, civil, and way that you feel comfortable. So, right, reminding those around you that, you know, please wear a mask. That matters. You know, please don't create large groups congregating in front of my classroom or in front of the building. Those are things that we want folks, right, to be able to feel empowered to do.
Yeah, there was a good article in UK Now this morning with some tips for having those conversations. And I've found that just a simple gesture of like that, if they've got the mask here, that if you just do this, that at least they'll do it for a second. But if everybody's doing that to them, then they'll stop pulling it down, I would think, at least while they're on campus. So Al Cross, ever the master questioner, asks, what is the purpose of using different terms, isolation and quarantine? Or is that more of just an internal way of keeping track of who is COVID positive and who has had a significant contact?
Yeah, so we're using that same language that's used in the national public health landscape for right, isolating for a COVID positivity and quarantining if you're just a high exposure contact.
But it means the same thing pretty much, right?
Well, it means in both situations that we don't want you to, right, that we want you to physically be apart from others, yes. But the reason you're doing that for isolating and quarantining and how you can do that on campus looks different, right? So we don't allow, for example, a COVID positive student to stay in a general residence hall room. That's why we have the specific isolation residence halls. We would allow a student to quarantine in their own room in a general residence hall.
Okay, and Sarah's just dropped the official definitions in the chat. Thank you, Sarah. That's really helpful. What percentage of our students, roughly, I don't know if you can answer this, that are positive, are they choosing to isolate either in their, okay, let me isolate if they're positive, yes. On campus, either in a fraternity or sorority or residence hall versus going home?
Mm-hmm. So I haven't, I not that we can't disclose that. I don't think I've been asked that before. I don't have the data, but I can say the options we offer, I haven't looked at the data. We have the data. as Tyler Gayhart, another of your wonderful PhD students, would tell me, that the data's in the computer. You just have to ask it for it. So, you know, I would say that what we offer students, if you live on campus or you live in a residence hall or a Greek facility with a contract that's managed by the university, we offer you automatically the opportunity to isolate in a separate space that isn't campus, which for most people is going home to family. Or you can transition to one of our isolation facilities. If you are living off campus, we work with you to make sure that the space you're living, whether that's your apartment by yourself or in a space with other students, that you can use the space around you to isolate as you should. If that means you are sharing a bathroom with someone else, that you understand you've got the supplies to clean the bathroom before and after you go in, and you understand the importance and how to do that. But yes, those are the options. Isolating in a facility, on campus, isolating back home, or if you're off campus, isolating back home, wherever that may be, or within your apartment or house off campus.
Okay, we are coming right up to the hour, and I was just going to say, Lance, that you have done Governor Beshear proud in this press conference in front of all these communicators and journalists, and it was just a wonderful session for us to ask a lot of questions. I learned a lot and I feel like I've been plugged into all this, but I learned a lot today. This was really helpful. So thank you guys all for doing that, and as you said, we've got a lot of folks that are representing our college very well in all of this on the UK team with Sarah and Jay and Tyler and lots of folks. So we're proud to be doing our part in the college as well.
Yeah, it certainly takes us all. And I think at the end of the day, we're working to keep one another safe as we move through this semester. And we thank you for this opportunity, Dean Greer. And I think, as you mentioned when we started, one of the reasons we're recording is we're going to take and edit this so that future groups of faculty who are requesting this, we can provide a clip that they can watch to get at some of these things. So thank you all for being that brainstorming space.
And I'll make sure I send this to you as soon as it's finished up in the cloud. I'll send you the link. Okay, thanks guys. Have a safe weekend. Bye-bye.